Hi, welcome to Case of the Day. Today is Tuesday. We're on our 69th case, and this is titled A Whole Spine or Whole Body Study May Help Before a Difficult CVJ Biopsy, or it could be a difficult spine biopsy, period. So, this was a 35-year-old with pain in the left side of the base of the skull, had an MR. The MR showed a left occipito-atlantal erosive lesion. It is an arthropathy, and typically this would be of infective etiology. The patient was sent for, so there was no other study done, and was sent for a CT guided biopsy. And for these kind of studies, I called them for a pre biopsy assessment with a contrast study. And so there was an arterial and a venous phase, and you can see here that the vert is here, but when it was winding around C1, it was about 7 millimeters inferior to this section. The carotids are far away, the occipital vein is here, and there was another vessel. And basically, this biopsy had to be done with intravenous contrast during the study so that I could avoid the vessels. And the head was a little inflection. So that's what I did using an 18 gauge barred needle. I was able to maneuver the needle into this osteolytic portion, deployed the gun, biopsied it. I did give contrast a couple of times to make sure that none of the vessels was involved. And while the throw is 20 millimeters, I controlled it to about 15 mm and did the biopsy. Got 4 cores, 2 for histopath and 1 each for gene expert and culture, but couldn't get material for aerobic or fungal. And that's after the biopsy. Now, just to be sure, and I had no other procedures, so I kept the patient in the supine position and then said, let's just do a check scan at 5 minutes so that we're sure that there's been no bleeding. At which time, on a hunch, I asked the tech to run a quick scan through the whole spine and pelvis, and this is what we found: a large lesion in the left posterior ilium with abnormal soft tissue with ill-defined sclerosis, findings that are very typical of osteomyelitis, classically tuberculosis in our country. More importantly, this would have been what I call a blind dart biopsy. Blind dart biopsies are where you can just blindly put a needle inside because everything's so safe, and a biopsy here is probably one of the simplest things you can do. There's nothing that comes in the way, there is no complication that you would expect. Even if there is bleeding, you can compress it and make it stop. And that's really all there is to it. There's no nerve that comes in the way. So it is literally one of those biopsies you can do blindfolded. Faster, quicker, easier, simpler. The CVJ took me 21 minutes, and normally these biopsies shouldn't take more than 10 to 12 minutes from the time you put a marker to the time you wash out. And you can get much, much more material. So if I had thought about it, because many patients with CVJ involvement, whether it's TB, METS, or myeloma, are likely to have disease in some other bones, and it would have been so much simpler. Now, in MR, unless asked for, we wouldn't do a whole spine, so that wasn't done. And there were cost constraints, so a whole body PET CT was not done. And none of this is guideline based, so it's not as if this had to be done. This is something you think of doing because perhaps it makes your life simpler. And I've done this before, and which is what really ate me up today, because I've done this in the past. Here was a patient in 2019, 39-year-old CVJ lesion, and this is so simple to do, right? There's nothing that comes in the way here. But I still thought I should do a whole spine, found this similar iliac bone lesion, biopsied it, it turned out to be tuberculosis. I should have done that for this patient. Anyway, but when you look at spine biopsies in the cervical region, I just did this post about, I think 10 days ago, and I listed all the approaches you have to the cervical spine, to cervical spine lesions. Now, transoral typically we don't do. But everything else is what we would do, whether it's anterolateral, posterolateral, like today's patient was a posterolateral CVJ, etc. And though most of these are easy, perhaps it's a good idea, especially when the pre-test findings are suggestive of either TB, METS, or myeloma, to get some whole body scan done. And that would make life easier, but more importantly, allow you to biopsy a lesion that will yield more material, especially if it's lower down in the spine. Um, where things get much easier. You can go transpedicular, or in the pelvis where there is really no other structure that you would have to worry about. So, lesson learned, I think, before difficult biopsies, especially CVJ and upper cervical spine, it's a good idea to get some kind of a whole spine, whole body scan done. This is what we're doing next month. I created this flow chart. That took a lot of time, but once I did this, I realized that we can actually go step by step and do an entire course. And I've explained the entire curriculum in this 12-minute video, so you can just follow the link and go through it if this is of interest. I mean, otherwise, it's fine. My WhatsApp channel, and thank you so much for viewing this.